Infectious disease, blood-borne pathogens, and universal precautions. An infectious disease is classified as an invasion of a host by a microorganism called a pathogen. Pathogens cause disease either by disrupting vital body processes or stimulating an immune response. Bacteria, viruses, parasites, and fungi are the most common pathogens that we'll see. An infectious disease may be contagious. A disease is termed contagious if it is transmitted from one person to another. Transmission can occur in various ways, either direct or indirect. There are several different ways that we can have a direct transmission. The first is contact between body surfaces. Examples of this would be touching or sexual intercourse. A droplet spread is another example of a direct transmission. This typically includes the inhalation of contaminated air droplets from someone in close proximity who is ill. And third, fecal oral spread is another direct transmission route. Feces on a host's hands are brought into contact with the new host's mouth, and hence this disturbing but slightly cute picture. In direct transmission, the pathogen travels by means of inanimate objects such as water, food, towels, clothing, or even eating utensils. This pathogen can also occur through a vector, things like animals, insects, or birds. Mosquitoes are a great example of vector transmission. Mosquitoes frequently carry West Nile, Zika, and even malaria. Another example of indirect transmission route are air sources. Pathogen transmission. Pathogens are looking for openings in the body to enter. Pathogens can enter through the skin, the respiratory system, digestive system, or even the reproductive system. Whether a pathogen will actually infect the new host is determined by several factors. Whether a pathogen will actually infect a new host is determined by several factors, including acquired immunity, the overall health of the individual, and health-related behaviors. There are 5 stages of infection. The incubation stage lasts from the time a pathogen enters the body until it multiplies to the point where signs and symptoms of a disease begin to appear. This stage can last from a few hours to many months, depending upon the concentration of the organism, the virulence of the organism, the level of the immune response in the host, and the presence of additional health problems. During this stage, a host may be infected but is not considered infectious to other people. The predominant stage. There are a variety of signs and symptoms, such as watery eyes, runny nose, slight fever, or even malaise, which is fatigue, that may briefly develop. During this stage, the pathogenic agent continues to multiply, and the host is capable of transferring the pathogen to a new host. This individual should be isolated to prevent the transmission of the disease to others. Next is the acute stage. The disease reaches its greatest development, and the likelihood of transmitting the disease to others is at its highest potential. The body is resisting further damage from pathogens. Fourth, the decline stage. The first signs of recovery appear signaling that the infection is ending, but a patient can experience a relapse if they overextend themselves. And finally, the recovery stage. This is characterized by an apparent recovery from the invading pathogen. However, since the overall health has been compromised, the patient is susceptible to other pathogens during this time. Following the recovery stage, subsequent exposure to that pathogen may not result in infection since the body has built up an immunity. It must be stressed that immunity is not necessarily permanent. Immunity. When the immune system has successfully eliminated the effects of an invading antigen, it is primed to respond quickly and effectively should the same antigen appear again. We can have acquired immunity, which occurs after an infection, or we can have immunizations, which come from shots like vaccinations. Preventing the spread of infectious diseases. There's several things that we can do. First and foremost, wash your hands. Keep your immunizations up to date. Perha- Prepare and handle food correctly. Use antibiotics only for infections caused by bacteria. Be careful around wild animals and unfamiliar domestic animals. Try to avoid insect bites. Protect yourself by using safer sex practices. Do not use injectable illegal drugs. Stay alert to disease threats when you travel or visit other countries. And develop healthy habits such as eating well, getting enough sleep, exercising, and avoiding tobacco and illegal substance use.